Good afternoon on this snowy, freezing rain day. I hope many of you had a chance to enjoy Islander Day yesterday. I know there were many people outside enjoying outdoor activities and enjoying being in PEI. Today, I'll give an update on COVID-19 in PEI in Canada, the variants, vaccine distribution, mention briefly custody arrangements, as well as the federal restrictions on international air and land travel. In PEI, there are no new cases of COVID-19 to report today. We currently have 2 active cases. Since the pandemic began, we've had 114 cases of COVID-19 without any hospitalizations or deaths to date. Worldwide, there have been over 109 million cases and over 2.4 million COVID-19 related deaths. In Canada, there have been over 826,000 cases and over 21,300 deaths related to COVID-19. It is interesting to note that 89% of our deaths in this country are those 70 years of age and older, and 96% of the deaths are in those aged 60 years of age and older. The trends in Canada in the past week show a continued steady decline. New cases were down 16% and deaths were down 31%. Hospitalizations were down 14% and ICU admissions down 10%. Canada's month-long measures, which were fairly restrictive, seem to have been successful in reducing the incidence of cases. But to note that the week of February 9th, the rolling average number of daily cases is almost 10 times higher than when we had the summer lows of less than 400 cases per day. Outbreaks continue in high-risk populations and communities such as hospitals, long-term care facilities, workplaces, correctional centers, and other congregate living settings. These outbreaks underscore the importance of sustaining public health measures and individual practices and not easing restrictions too fast or too soon. On Saturday, we announced the first case of COVID-19 variant in PEI, specifically the B.1.1.7 variant, originally identified in the United Kingdom. We were the last province in Canada to report a variant case. Fortunately, the individual diagnosed with the variant strain went into self-isolation as soon as he arrived in PEI and had no close contacts. Out of an abundance of caution, people on a flight from Montreal and others involved in screening, testing, and transporting the case were tested, with all results being negative. It does not appear that there has been transmission of the variant B.1.1.7 in our community. Detecting this case on routine testing while the individual is in self-isolation suggests our surveillance, testing, and isolation protocols are working. The arrival of a variant strain was not unexpected and is not cause for alarm. The variant reminds us, however, that while we are growing COVID-weary, now is not the time to let our guard down. As we were pointedly reminded by the World Health Organization last week, complacency is as dangerous as the virus itself. It is normal for variants to emerge as viruses continually evolve and change. We can expect to see more variants in the weeks ahead. And why are we concerned about these variants? These mutations are called variants of concern because they are known to spread more easily. They are more contagious than the original strain, and if not contained, they can lead to an exponential growth in cases. If variants are allowed to spread throughout communities, they are all capable of replacing the original strain. If a variant gets a foothold, and that may happen within a number of months, the strain can become the dominant circulating strain of COVID-19. And because the variants may be more infectious, there will be increased transmission leading to significantly more cases, more hospitalizations, and more deaths. Although the variants have emerged as a threat globally and locally, we do know that public health measures are effective against the new strains of COVID-19. To date, the evidence suggests that approved vaccines provide protection from severe disease and hospitalizations related to the variants of concern. More research is needed and is ongoing to determine the impact that some variants have on vaccines. The variants of concern spread in the same way as the original virus. This means that the public health measures and the vaccine continue to be our best tools against COVID-19, including the variants. At a population level, our strategy will continue to focus on keeping COVID-19 out of our province, and if we do get cases, we will work hard to contain the virus and limit transmission. At an individual level, we must continue to follow the basics we've talked about for so many months, maintaining the physical distance of 2 meters from people outside your household, avoiding crowded spaces, and keeping our circle of contact small and our contact brief. Washing our hands often, wearing a mask properly in closed indoor spaces, staying home when you're not feeling well, getting tested for COVID-19, even with mild symptoms. Avoid unnecessary out-of-province travel, and when your turn comes to get vaccinated, if you are able to do so, please get immunized. Do this for yourself, your loved ones, and our province. I've been asked different times whether I have been immunized or not, and it is not yet my time to be immunized against COVID-19, but I am anxiously awaiting my turn like many others. And when it is my turn to be vaccinated, I will be there and happy to receive the vaccine without any hesitation. I urge all rotational workers, including truck drivers and anyone approved to work isolate, to please follow the testing and isolation requirements for your specific situation. National vaccine supply has impacted our ability to immunize islanders. Most recently, similar to other provinces, some doses of the Moderna vaccine that were planned for PEI are being sent to Canada's Northern Territories. Specifically, in our next dose expected from Moderna, we will have 700 doses less, which have been diverted. This decision was made by the federal government, and it is understandable given the special challenges in Canada's north. However, we are expecting to receive a steady weekly supply of a Pfizer vaccine for the remainder of February and all of March, with substantial increases expected between April and June. We are continuing to immunize people as fast as we get the vaccine. And despite disruptions in supply, we know that residents of long-term care have mainly received 2 doses of vaccine, and we will be moving to finish community care second doses as well this week. I will note that Health Canada has approved the Pfizer product label and has changed it from 5 doses to 6 doses. So this week, we will be receiving special syringes to allow us to get an additional dose from the vials of Pfizer. For instance, instead of receiving 975 doses of Pfizer this week, we'll actually be receiving 1,170 doses. As of Saturday, 10,610 doses of vaccine had been administered in PEI, including 4,900 second doses. And our goal is to immunize 75 to 80% of our adult population in PEI. So by the end of March, we'll have been able to vaccinate 10 to 12% of that adult population. Islanders age 80 and over living in the community are continuing to book appointments to be immunized, and I know Marion will provide an update on the number of people in this age category who have appointments booked. I mentioned the community care clinics. The second doses are underway as well this week. Rotational workers, those calls have started, and we've advised that international rotational workers will be the first ones called, and this will include commercial airline pilots and military. And then remaining rotational workers and truck drivers, going from the oldest to youngest, will be called and worked in to clinics in the next weeks. Rotational workers who are not registered can do so by contacting our office or on the provincial website. Community health nurses in Abequit and Lennox Island First Nations will start their immunization clinics late this month and early March. Healthcare workers with direct patient care who are required to maintain capacity within the health system will continue to be immunized. Clinics start this week for residential, group homes, and congregate living settings in the days ahead. The goal of the vaccine program is to protect people from severe disease and hospitalization related to COVID-19. The vaccines may not protect everyone from getting the virus and spreading it inadvertently through asymptomatic transmission, but it is a very important line of defense and one more layer of protection. Until we know more about the impact of the vaccine on asymptomatic transmission, our public health measures will remain in place, and we also are, and we've talked about it before, how important the herd immunity is. We know AstraZeneca and other vaccines, which are stored at the 2 to 8 degrees Celsius, are anticipated soon, and we will be awaiting Health Canada and NACI approval and guidance on these vaccines. The pandemic presents unique challenges for families involved in co-parenting children, especially when parents live in different provinces. Our office has developed a process to support families who are required to travel to share custody of their children. And all families involved, please visit the website for further information. And I'd like to note there is a testing component related to the custody travel. Parents who live off-island are required to have pre-travel approval to pick up or drop off their children in PEI. We've also had some recent questions about masks. Some countries are advising double masking, some are enhancing their masking requirements. In PEI, masks will continue to be mandatory in public spaces. And for many islanders, wearing a mask has become normal. When they go out, they check to see if they have their wallet, their keys, and their mask. Thank you to individual islanders, businesses, and organizations for stepping up and supporting compliance with mandatory masks. Some people are not able to wear a mask for medical reasons. These reasons may not always be obvious. It's important that we be patient and understanding and not judgmental towards individuals who are unable to don a mask. Masks offer an important and additional layer of protection and do not replace other measures, including physical distancing. Masks should fit properly, cover the nose, mouth, and chin, and with no gaps, fitting securely to the head with ties or ear loops. It's important that masks be well made and worn properly. Masks offer less protection if they do not cover the nose, mouth, and chin. Masks should be made of at least 2 layers of tightly woven material and include a middle layer or filter, and masks should be washed often. Although the new Government of Canada restrictions for international travel are federally administered, I remind islanders to be aware of some of the changes announced last week, and these are both for land and air. And I won't go through all the details, but please check the website and know it is for both land and air. And regardless of these international requirements, anyone arriving to PEI from an international destination who has completed the quarantine and the testing federally will still be required to self-isolate for 14 days upon arrival in our province, and there are testing requirements as well. As mentioned last week, it is preferable for individuals to self-isolate in accommodations that are separate and apart from others. That is the safest and best option. But if that is not possible, it is ideal if the entire household self-isolates together for a minimum of 14 days. If it is not possible for the household to isolate, the traveler may be able to quarantine in a home with others, provided they have no contact with anyone else and have their own room and bathroom. Anyone planning international travel to or from traveling to PEI should visit the Government of Canada website for details around regarding the rules around submitting travel information, COVID-19 testing, and quarantine. I do understand there are some exceptions to the federal requirements, and those questions could be directed to the Government of Canada website. Thanks to all for the steadfast support from islanders, businesses, and communities as we continue to do well navigating our way through this pandemic. The situation last week in our neighboring province of Newfoundland and Labrador is an example of how quickly things can change with COVID-19, how fast it can spread, and the amount of disruption it can cause. And I know we've said it before, COVID-19 moves when people move, and if we let our guard down, it could spread rapidly. We will continue to take a steady and cautious approach while working hard to reduce the risk of importation and staying ahead of COVID-19. As someone reiterated on my team this morning, the road ahead should be a lot shorter than the road behind us as we look ahead at getting our population protected with a vaccine and adjusting our public health measures as soon as we can. So as we continue our journey along this road with COVID-19, let us continue to be patient and continue to be kind. Thank you. En français en premier. I'll just say a few words in French before turning it over to Marion. Bon après-midi. À l'île du Prince-Édouard, il n'y a aucun nouveau cas annoncé aujourd'hui. Nous avons actuellement 2 cas actifs. Depuis le début de la pandémie, nous avons eu 114 cas de COVID-19. Samedi, nous avons annoncé le premier cas d'un variant de la COVID-19, plus particulièrement le variant B117, qui a d'abord été identifié au Royaume-Uni. Nous sommes la dernière province du Canada à avoir signalé un cas de variant. Heureusement, la personne ayant le variant s'est auto-isolée dès son arrivée à l'île du Prince-Édouard. Il n'avait aucun contact étroit. Il semble qu'il n'y a pas eu de transmission du variant B117 dans notre communauté. Le fait que nous avons détecté ce cas lors d'un test de routine pendant que la personne était en auto-isolement laisse penser que notre système de protocole de surveillance, de dépistage et d'isolement fonctionne. L'arrivée du variant n'est pas inattendue et n'est pas une cause d'inquiétude. Nous continuons à immuniser les gens aussi rapidement que nous obtenons les vaccins. En date de samedi, 10 610 doses de vaccins ont été administrées à l'île du Prince-Édouard, compris 4 900 deuxièmes doses. Les insulaires de 80 ans et plus qui habitent dans la communauté continuent de prendre rendez-vous pour être vaccinés. Et cette semaine, nous offrons les vaccins aux adultes dans les foyers de groupe, les refuges et les résidences de soins. Nous nous attendons à recevoir un approvisionnement hebdomadaire régulier de vaccins Pfizer pendant le reste de février et tout le mois de mars, avec d'importantes augmentations entre avril et juin. Même si les nouvelles restrictions du gouvernement du Canada concernant les voyages internationaux relèvent du fédéral, je veux informer les insulaires de certains des changements annoncés la semaine dernière. Et c'est toute personne prévoyant un voyage international en provenance ou à destination de l'île du Prince-Édouard devrait visiter le site web du gouvernement du Canada pour obtenir des précisions concernant les règles sur la présentation d'informations de voyage, le dépistage de la COVID-19 et la quarantaine. Et je sais qu'il y en a des exceptions aux exigences fédérales et puis ces questions-là devraient être posées au gouvernement du Canada. Mais toute personne voyageant à l'île du Prince-Édouard depuis une destination à l'étranger qui a effectué la quarantaine fédérale et a reçu un résultat de test négatif devra malgré tout s'isoler pendant 14 jours à son arrivée dans notre province. Merci. I'll turn it over to you, Marion.
Thank you. Good afternoon, everyone. I'll give a little update on our COVID clinics and our vaccine planning. Our testing clinics, and due to the weather this afternoon, all of our COVID-19 testing clinics and cough and fever clinics have been closed for the afternoon. If you have symptoms of COVID-19 that do not require immediate care, please stay home and self-isolate until you're able to get your test and the test result. We continue to book patients aged 80 and over for upcoming vaccination clinics, And so far, mid-morning this morning, we had approximately 4,100 individuals who've been booked over the telephone into these clinics. As a reminder to these individuals remaining in that group, the number to call is 1-844-975-3303. The lines are staffed from 8 a.m. to 4 p.m. and have been available 7 days a week. This afternoon, our phone line is closed, though, because of the weather and the facility. Over the weekend, the call volume was significantly lower, so these lines will be staffed for these hours at least until Friday, and we'll assess the need for continued staffing and what the hours of operation should be. People can request a callback for an appointment by using our online web form, which is located at the princeedwardisland.com/COVID vaccine website. This web form will continue to be received, and appointments will continue to be made by receiving a call back 7 days a week. We are continuing to build and test our online platform that will allow people to book their appointments for vaccination directly online. This system will be ready for our next call to the public for vaccinations, and people will be able to use this system to book vaccine appointments. Our registered rotational workers and registered truck drivers are receiving calls this week to be booked for their vaccine appointments as well, and these appointments will begin in March. As more vaccine is confirmed to arrive on PEI, we will add more clinic appointments and ensure the vaccine continues to be administered as efficiently as possible. As Dr. Morrison mentioned, the long-term care homes on PEI have now had their second clinic for their second doses of COVID vaccine for their staff and residents, and second dose clinics for the vaccine continue for those in community care sites, with many of those being completed this week. These populations are our highest risk groups for their immunization and protection, and this is a major step forward in our fight against COVID-19. The congregate living sites have started this week and today receiving their first doses as well. I want to thank everyone again, as Dr. Morrison does every week, for their ongoing patience, understanding, and kindness as we continue to work through this pandemic together. Your attention to the public health measures has been so valuable and so important in our success throughout this pandemic. So thank you, and I'll open it back to questions, I guess.
Thank you, Marion. And we'll open it to questions from the media.
Laurent Rigaud, Le Bois.
Bonjour, Dr Morrison. J'avais une question sur ce que vous avez expliqué pour les restrictions concernant les voyages, ces restrictions qui vont se mettre en place au niveau fédéral et celles des provinciales qui vont se maintenir aussi. Est-ce que vous savez combien de temps ça va durer, c'est mis en place pour combien de temps ces quarantaines fédérales?
Bonjour Laurent. Alors, ça commence pour la plupart pour les personnes qui viennent par l'aéroport. Ça commence vraiment le 22 février. Il faut qu'ils ont un test avant qu'ils arrivent. Et puis après ça, ils ont un test ici. Plus après ça, un autre test pendant leur période auto-isolée. Et vraiment, depuis vendredi, hier, le 15, s'il vient en voiture des États-Unis, il doit montrer qu'ils ont eu un test négatif entre 72 heures avant d'arriver. Et puis, commençant le 22 février, il doit avoir présenté le test négatif, mais il doit aussi prendre un test après qu'ils sont ici au Canada. Le durée du temps, on ne sait pas pour certaines, c'est les lois fédérales et puis toutes les restrictions fédérales sont mises en place pour un certain montant de temps et puis la plupart du temps, ça dure même plus long que ça et puis ils éloignent le temps. Mais j'imagine que ça va être en place au moins pour les prochains mois.
Merci. Et j'avais une question sur les vaccins. Vous en avez parlé en anglais. Est-ce que vous pouvez nous redonner fin mars, vous avez dit quel pourcentage de la population serait vaccinée? Quel est l'objectif pour fin mars? Et quels vont être les groupes, les prochains groupes à recevoir le vaccin, s'il vous plaît?
Alors, le but est de vacciner 75 à 80% de la population adulte à l'île du Prince-Édouard. Et on reçoit à peu près à ce moment, on pense recevoir 23 000 doses de vaccins à peu près par le fin de mars. Alors, on pense qu'on va être vacciné au moins 10 à 12% de la population adulte avant la fin de mars. Et puis, on sait qu'à partir de ça, le montant de vaccins qu'on reçoit elle va augmenter tellement. Et on espère de vacciner les autres adultes dans les prochains 3 à 4 mois.
Merci.
Gabrielle Dumont, Radio Canada.
Good afternoon to you too. Bonjour, Dr. Morrison. J'aimerais vous poser une question en français. J'aimerais savoir plus de détails concernant la personne qui a été diagnostiquée avec la variante de la COVID-19. Il me semble que la quarantaine de cette personne-là, ça devrait se terminer cette semaine. Est-ce qu'elle est toujours en auto-isolement? Si oui, est-ce que vous allez prolonger sa quarantaine, la quarantaine de cette personne-là comme une forme de précaution?
Bonjour, Gabrielle. Et puis, oui, c'était le monsieur qui est trentaine qui est arrivé à l'île du Prince-Édouard d'un voyage international en le début de février. Et il s'est auto-isolé tout de suite. Alors, il a bien fait. Il reste en isolement un peu plus long pour qu'on... alors, on augmente, c'est plus long pour son période isolée, mais je suis en train de aussi discuter ça avec mes collègues partout au Canada pour qu'on fait la même chose avec ces personnes qui ont la variante. Alors, c'est une discussion, mais pour maintenant, il reste en isolement plus long que le 14 jours, juste pour être un peu plus... pour s'assurer qu'il ne va pas transmettre le virus.
Parfait, merci. Et ma deuxième question, c'est toujours au sujet des variants, parce que je sais que vous envoyez toujours les échantillons à Winnipeg pour faire les tests de dépistage de variants. Et je sais aussi que vous étiez en discussion avec vos homologues en Nouvelle-Écosse pour peut-être mettre sur pied un laboratoire ici, dans la région Atlantique, pour réaliser ce genre de tests-là, des variants. Où vous êtes rendu dans vos discussions par rapport à ces laboratoires en Atlantique qui seraient en mesure de dépister les nouveaux variants?
Alors, vous savez, on vient de en parler il y a la semaine passée. Alors, j'ai pas vraiment un update là-dessus aujourd'hui, mais je sais que je vais parler bientôt, plus tard cet après-midi, avec mes collègues. Alors, j'espère avoir un peu plus de détails avant la fin de la semaine.
OK, parfait. Merci beaucoup. Bonne journée.
Bonne journée. I'll just stop for 1 second because most of the questions in French, I was just translating other parts that I had already said in English, but the last question was, I had mentioned right now that our positive tests for COVID-19 are sent off to the National Microbiology Lab in Winnipeg for sequencing to determine if there are variants. But we have started some conversations with Nova Scotia because they may be able to do some sequencing there. They have also been sending out their variant or their positive cases to the National Microbiology Lab. But if we could do it more regionally, it may increase the turnaround time and make that a little bit faster. So that conversation is ongoing.
Brittany Spencer, CBC.
Hi there. My first question is for Dr. Morrison. You mentioned that with the next shipment of the Moderna vaccine, 700 doses will be sent to communities in northern Canada that need it. How long do you expect some of the doses that were originally supposed to come to PEI to be, diverted to other communities? And you also mentioned you're expecting big increases of the Pfizer vaccine in the coming months. Can you be more specific about how much you're expecting those shipment sizes to increase?
Hi, Brittany. So in terms of Moderna, we were reassured that although I would see from the Moderna perspective a decrease in these doses to try to manage the logistical issues of our the territories, we would actually get that amount back in the second quarter. So we do anticipate that those doses of Moderna to be available to us, just not in these next couple of weeks. In terms of the Pfizer, so the contract that Pfizer has with the country was really to try to provide at least 6 million doses during this first quarter. And then that amount of vaccine from Pfizer to the country is anticipated to be closer to 23 million in the April to June period, and that's up from the initial 20 million. So, and as we've talked about before, that the planning projections are based on a per capita distribution of that vaccine.
Okay, and my second question is about what effect does this have on PEI's overall vaccination goals, with specifically to do with some of the community clinics that are set to begin next week? Will there be any impact there?
And I'm glad you asked that, Brittany, and I think we've been trying to make sure that we look ahead. As we've said, we want to vaccinate a good portion of our adult population here so that we can have herd immunity in this province and protect islanders. And so this is a slow and steady march. So as we get vaccine, we're going to be setting up clinics and setting them up in advance of the vaccine getting here. And we're able to do that very efficiently. Great work with Health PI and partners to get this vaccine out to our clinics. So and when we talk about that 700 doses, even if it's not all here this week, we know we still have other vaccine coming, and we will anticipate more vaccine coming. So we will continue to just book the clinics. And with these changes, we have to be flexible. We have to be able to adjust to these little bumps along the road. And that has been the way since the vaccine rollout has started. And so sometimes I have to even remind myself that, this time last year, we didn't even have a COVID test that we were able to, test for COVID in this province, certainly. And even last summer, I wouldn't have anticipated we would have had a vaccine ready to roll out and starting to roll out the end of December. So I think it's great that we have these very good vaccines that are available. And I know that the national vaccine supply has limited our ability to get islanders vaccinated, but we are going to do the very best we can with what we have. And I don't think it's going to have a huge, and it really hasn't had a huge impact on our clinics. We just continue to vaccinate the people that need to be vaccinated with what we have.
Thank you so much.
You're welcome.
Stephanie Kelly, CBC.
Hi there, good afternoon. I have two quick questions for Dr. Morrison. The first one, I'm just wondering if there are any sort of plans or discussions at all about possibly changing or increasing the self-isolation requirements because of the presence of the UK variant of PEI.
So, hi, Stephanie. So we have been having some of those discussions, and at this point in time, we have not changed any of our direction around isolation requirements. I think where you've seen some of the adjustments in isolation requirements particularly have been around households, so that if you aren't able to isolate separately from others, then they're extending that quarantine period. I think one of the provinces extending that quarantine period from 14 days to 24 if you're isolating with others, and then everyone in the household would be isolating for that extended period of time. We have not done so yet, but we continue to monitor what's going on and making sure that we really are making sure the people who need to isolate really well. The people who need to be tested are tested. So at this point, we haven't changed that isolation requirement.
Okay, thanks. And just one really quick, just a clarification. You mentioned earlier that clinics will start this week for residential group homes and congregate living settings. I'm just wondering if you could be a little bit more specific about what those living settings are.
So it will be, and I don't have the list of them in front of me, and Marion may be able to fill in. I know some of the homes in residential congregate living settings in the western part of PEI. I think they start tomorrow and the next day. We've talked about trying to reach out through for the homeless shelters as another group, and also. Other congregate living settings would include, for instance, corrections in terms of their staff as well in that particular setting. So I think, it would include, you might list some of the ones. I had them all in front of me this morning, but you can jump in.
I can remember a few of them. I know today they were going to a number in Queens County, so places like Chapel Court, the Bedford McDonald House, Lennox Home, and a number of those types of group homes and care facilities. And Queens County Residential Services is who we're working with on some of the other group homes and settings as well as the ones Dr. Morrison mentioned. So the ones in Queens County, they did go ahead today with the weather this morning. There were some that are happening for Queens County Residential Services homes will be happening tomorrow, and Thursday and Friday we'll be going to the western and eastern ends of the province to do those same type of residential care homes.
And it's also you imagine some of the second dose community care clinics are also going to be in western part of the province this week. So trying to do those at the similar time so that when they're in the area.
Thank you.
Stu Neepy, The Guardian.
Hi. Good afternoon to you both. I guess this next question for Ms. Dowling. Apologies if I've missed this, but have all sort of second doses for residents and staff of long-term care and community care homes have those been completed as of today?
There was a number of community care facilities that were scheduled for today, which have been rescheduled till tomorrow because of the weather in that area of the province at the time this morning. The long-term care homes have all now received their second dose clinics. But we continue to have people move into those homes, or if there are new staff that come to work at those homes, that we're continuing to immunize with their first doses and those types of things. The other piece that's happening is this week, and that has started Today, it did go ahead with some of our clients who are awaiting placement within long-term care facilities. They're receiving their first doses, so they're not yet living in those long-term care homes, but they are receiving their first doses as well this week, so that we do have a good layer of protection for those individuals as they move into our long-term care homes. So long-term care homes have had their second dose clinics completed. The community care facilities, there are a number of them yet to complete this week, and they should all be finished, I believe, tomorrow. And there is one more home, Le Chez Nous, of course, which was rescheduled due to their individual facility situation, and that will be happening next week.
Okay, thank you for that. So my second question, I guess, would be for Dr. Morrison. 2 weeks ago, you'd mentioned you were reassured a little bit about the use of rapid testing. Now, some news reports have sort of indicated that PEI's deployment of rapid tests appear to be pretty high, although the federal website seems to have some outdated information on it. So I'm wondering if you can tell me, first of all, in which cases are rapid tests actually being deployed on Prince Edward Island, and can you tell me how many have actually been deployed and how many actually used?
Hi, Stu. And I'm not sure. I do understand that there may have been a national media report that had some of PI's rapid test numbers that weren't quite accurate. So we are using rapid tests here, and we've used them at our community hospitals, so Montague and Alberton hospitals. We've used our rapid tests as part of the 20 to 29-year-old testing, so they have been used there. And we are actually in the process of discussing some pilot testing of our rapid tests in conjunction with a PCR test, sort of almost a quality assurance in a location. So we're hoping that will be able to start later this week. So I believe it's around, I don't have the numbers in front of me, Stu, but I think similar to the rest of the country, of the tests we've received, we've only used about 2.5% of those tests received, and that's fairly consistent. I believe the rest of the country has used, I think, a smaller number of those rapid antigen tests. And we've talked before, too, Stu, there's the ID Now, which is a molecular-based rapid test, which is the one we've been using primarily. And then there's an antigen rapid test, and that's partly what we would be using or in consideration of using as a pilot that we hope to have details on later this week.
Okay, thank you.
Good. I think that may be it. So thank you, everyone, and please be careful if you're on the road. Okay.